at the Vegas Chamber. I'd like to thank you all for tuning into a conversation with State Labor Commissioner Shannon and Vegas Chamber President and CEO Mary Beth Seawald. Before we get started, I'd like to take a moment to explain some features of this call. In order to preserve high sound quality, we'll be muting everyone on the call besides our presenters to make it easier for everyone to hear. If you'd like to ask a question, there are a few ways you could do so. If you're joining this call on the web or through the mobile app, you can ask a question by using the chat feature on the interface. We'll ask a question on your behalf. You can also ask a question by clicking the hand raise button on the interface. We'll call your name and unmute your line so that you can ask a question. Once you have asked your question, we'll read your line so everyone on the call can hear the answer. In order to preserve time, we ask that you please keep questions brief, and we'll be taking all questions at the end of the call. And now, please welcome the Vegas Chamber's President and CEO, Mary Beth Seawald.
Thank you, Carlos. I really appreciate that great introduction. Good morning, everybody, or good afternoon now. Boy, time flies. Thank you for joining us on today's teleconference with State Labor Commissioner Shannon Chambers regarding COVID-19 labor regulations. This webinar is going to offer you guidance today and information on state and federal labor resources and also how your business should comply. I want to give you a brief update on all the things that the Vegas Chamber is doing to help our members out and to help our community. The Vegas Chamber is in constant contact with leaders throughout our entire state. We're working collaboratively to find ways to support our healthcare personnel and facilities, essential services, the school system, and the supply chain operations. Also, we're making sure that the needs of businesses, employees, and 1099 workers are kept front and center. As resources and new information do become available, the Vegas Chamber will continue to present teleconferences like this one and webinars to provide you with the absolute latest in information. Speaking of which, tomorrow, April 3rd at 10 a.m., we'll be hosting a teleconference with Nevada U.S. Senator Catherine Cortez Masto to discuss federal legislation and programs that are being offered to help small businesses in Nevada. We'll also discuss the CARES Act, which was recently passed and signed into law, and that provides financial relief, if you didn't already know that, to businesses and individuals. All of our webinars and teleconferences are posted online and available to you 24/7 at vegaschamber.com and also on the Vegas Chamber's YouTube page. And now it is my distinct pleasure and honor to introduce Nevada Labor Commissioner Shannon Chambers. Commissioner, thanks for joining us today.
And thank you very much, Mary Beth, and thank you, Paul, and all the members of the Vegas Chamber. And I'm very happy to be here today. And again, thank you for the opportunity to talk to Nevada employers. And let me just say, in 6 years as the Labor Commissioner, I never expected to be in a situation like this and an event like this to hit everybody so fast, not only on the health side, but also on the employment side. So I just want to say up front that our office and the Labor Commissioner is here to try and address, many of the issues that have come up. I can't say that I can address all of the issues, but I certainly appreciate the magnitude that some of you and the situations and the decisions that you've had to make and the magnitude of those decisions. And unfortunately, many of those decisions have had to be made very, very fast. So my goal, and that's been my goal for pretty much the past month or so, is to try and give the best guidance possible, but just know that some of these events and some of the information are changing on a daily basis, sometimes on an hourly basis. So we will continue to give you the best information that we can, but just know that some of this that you're going to hear today is potentially subject to change. So with that, we'll go ahead and get right into the slide presentation, and you can go ahead and move forward, Carlos. So anticipating some of the issues that were going to start to occur when COVID-19 started to appear in early March, and it appeared probably earlier than that, the Labor Commissioner issued some guidance about leave and was anticipating that there were going to be some potential situations where employees may be subject to government quarantines, and I'll talk a little bit more about that later. But back in early March, the Labor Commissioner, in consultation with the federal government, said, well, let's get ahead of this a little bit in terms of leave and allowing employees to use leave. So on March 11th, 2020, I put out some guidance that if in fact there was a government quarantine, that an employee should obviously not be at work, but that the employer should not count that time against them. Now, I also factored in that obviously I don't want to have an employer have an employee out without any type of recourse. So what I advised is if there was a quarantine, the employee should be out of work. They should be offered some type of paid leave if that was available, and that was based on the passage of Senate Bill 312, which became effective January 1st, 2020. Unfortunately, the timing of when COVID-19 hit and some of the provisions of Senate Bill 312, that if you implemented paid leave starting January 1st, 2020, employees were not eligible to take that for 90 days. So obviously the ability to provide paid leave to an employee starting in early March based on a COVID situation would have been an employer that was already offering some type of paid leave, or an employer that decided to offer leave above and beyond what was required. So again, anticipating what was potentially coming down the road, this guidance was issued back in early March. So let's go ahead and go forward to the next slide, Carlos. So the next kind of step in all the events was the governor then announced the closure of non-essential businesses starting on March 17th. So when that was first rolled out, there was some confusion about who was going to be enforcing what was essential, what was non-essential. The first wave of who was going to enforce that fell on the labor commissioner, and so we were receiving hundreds of calls a day of, well, am I essential, am I non-essential business? People reporting businesses for being open that, you know, based on the initial guidance were deemed non-essential. So that first phase kind of went through. So we worked through that issue. And you can go to the next slide, Carlos. So on March 20th, the governor further clarified the announcement on non-essential essential. So again, we posted another notification on our website and also indicated that local governments will now be in charge of enforcing the closure of those businesses. So hopefully all of you on the call today know at this point whether you're essential or non-essential. We are still getting a lot of calls on that issue. We are getting a lot of calls from employees now who are working for various companies, various warehouses, and are stating to our office that they don't feel that what the company is doing is essential because they're not delivering food or they're not a grocery store. The labor commissioner is not weighing in on those issues. We are advising them that if you truly feel that a business is non-essential or that they are violating the provisions of the emergency regulations that were issued on this topic, that you need to call the local authorities or the local health department. And, you know, to my knowledge, not only in Northern Nevada, but in Southern Nevada, the local authorities are enforcing that particular issue. So this issue has, you know, died down a little bit. It is taking a new form in terms of now employees just not wanting to report to work. That's kind of now the next phase of this discussion, and I'll talk about that in a few slides. So go ahead and go forward, Carlos. So in light of all of this, the labor commissioner did put out some just kind of a friendly reminder about what the labor laws are in the state of Nevada and some of the questions that were being asked right up front. So one of the first questions that was asked right up front is, can an employer cut my hours or terminate my employment? Yes, Nevada is an at-will employment state, so these types of actions can absolutely be done. Again, employers have to make business decisions. They have to look long-term. So yes, they can decrease your hours. Yes, they can fire you. And the labor commissioner has continued to say that that is an acceptable practice and is fully legal in the state of Nevada. Where we're getting a lot of issues right now is about the decrease in pay. So a lot of employers are having to make very quick decisions. And again, we're getting questions of, can I decrease somebody's pay by text? Can I decrease somebody's pay by email? I want to do it tomorrow. The actual letter of the law in Nevada is that if you are going to decrease an employee's pay, it requires 7 days notice. Now, the labor commissioner interprets that as business days. So all of these timeframes that I'm going to talk about, the issuance of final paychecks, the decrease in pay, we interpret that as business days, and I passed a regulation package last December that fully codifies that we are now talking about business days. Obviously, the labor commissioner knows that there may be situations where that was not possible. So again, if a claim or complaint comes into this office based on that issue, we will look at that on a case-by-case basis. So again, letter of the law, 7 days, business notice. Again, how that's playing out in the real world, again, we'll look at that on a case-by-case basis. A lot of the other questions were, can we pay less than minimum wage? No, you cannot. The minimum wage in Nevada is still $7.25 if you were offered health benefits, $8.25 if you were not. If you are going to terminate an employee, the law, again, letter of the law says 3 business days. We are finding right now that there are employers now who are having trouble meeting payroll, so that first kind of wave is starting to hit. So we are seeing more claims and complaints from employees not being issued their paychecks upon termination and not being issued their paychecks even after a normal work cycle. So that is starting to hit this office, and again, we'll evaluate that on a case-by-case basis. So if an employee quits, the paycheck has to be issued again 7 business days after the employee resigns or the next regularly scheduled payday. And again, that's 7 business days. Getting a lot of questions about breaks and lunches now, and a lot of employers do not want their staff to leave the job site for potential fear of going out in public and coming into contact with somebody who may have symptoms of COVID-19 or who may have it and may not even be demonstrating any symptoms. So what I have been advising employers is that if you want to implement a policy like that and have people stay on site for lunch or for breaks, you need to implement that policy now, and you need to have employees sign for it. That is allowable. Now, I would not go so far as to do something completely restrictive where the employee feels like they're being kept there against their will, but I do think it's acceptable, again, as an employment practice. If you want employees to stay on site during lunch and breaks, you can do that. The other factor that you need to consider in doing that is if you're going to have employees in the same lunchroom at the same time, you need to factor in health and safety issues and the social distancing and some of the issues that get into OSHA and having, sanitizer, having soap, having things like that around. So again, if you're going to implement a policy like that, you need to kind of think of both sides of that issue. The other thing that started to come up is, well, people are calling in sick, again, not knowing what they had or what they didn't have, and employers asking, do I have to have them come into work? No. Last session, Nevada passed a law, Assembly Bill 181, that if an employee calls in sick, you do not have to have them come in to prove that they are sick. Now, again, as an employer, you still have the right to ask for, reasons why they're not coming in within reason. Again, that's a fine line of getting into personal information and different things like that. But, you still are entitled, even in this environment, if you feel that somebody's abusing leave, you certainly still can take personnel steps to address those situations. And quite frankly, now, if, you have an employee that is presenting themselves at the office with symptoms, you really have no choice but to address those situations. So the concept of paid leave, Nevada in 2019, the Nevada legislature passed Senate Bill 312. And I mentioned that earlier, that all Nevada employers with over 50 employees had to offer paid leave. So that was based on a typical 40-hour work week. So you would earn 0.01923 hours of paid leave for every hour worked. And again, factoring in a full 40-hour work week over a typical work year and benefit year, that came out to about 40 hours of paid leave. So 1 week of paid leave. Where this all got very interesting, as I mentioned earlier, is if you implemented this January 1st, Your employees could not take this for 90 days, which meant that they could not take this until the end of March. So when the COVID events started hitting, that was early March. And so there were some employees that were let go or were laid off before they had the opportunity to utilize any of the paid leave that they had accrued. In Nevada, there is also no requirement to pay out paid leave. However, if you have a policy as an employer, a policy contract agreement, or a collective bargaining agreement that says that you are going to pay out paid leave, the labor commissioner will enforce that. Now, the labor commissioner also knows, and we have been presented with situations where if an employer allowed every single one of their employees to cash out their paid time off, the business would go under, just given the fact that there is no revenue coming in and sometimes no ability to even make payroll. So, we have been handling those situations on a case-by-case basis, and what I've been telling employers is, work with an organization like the Chamber or contact our office to try and alleviate a situation like that up front. But again, technically there is no legal requirement in the law to pay out paid leave upon termination. So that's a question we've been getting a lot too. Employees being terminated, obviously not getting their unemployment right now, not getting paid. Can I get my paid leave? By Nevada law, no, there is not a requirement to do that. So, some of the other issues, obviously, and I'll talk about this in the next slide, is people who have traveled or crossed state lines, who come back, who, potentially now have exposed themselves to people who have COVID-19, or they may have it now. Again, the question, can my employer require me to stay away from work? Yes, they can. And obviously that depends on the circumstance. And so then the next question, if I'm required to stay away from work, can I get paid? And so let's go ahead and go to the next slide, Carlos. So again, I'll just go through this really quickly. So just a reminder about Nevada labor laws. We're still enforcing those. And the required postings, we are still enforcing those. However, obviously, if you're a business that's not open or even a business that is open, given all that's going on, the labor commissioner does have authority to grant extensions and to, again, look at situations on a case-by-case basis. So just want to point that out. But if you have heard, because that is going around, that labor laws are not being enforced, that is not correct. And there has been no discussion or directive to do that, I will tell you, at the state level or the federal level. So go ahead and go to the next one. So again, the gap between kind of when this first started at the early March and then getting towards the end of March, the federal government and the current administration realized that all of a sudden that now there were people who were in fact being exposed to or actually coming down with COVID-19 who were not going to be able to be at work or were going to have to be away from work to care for a child or for a loved one. So around mid-March, the federal government and the president signed what was called the Families First Coronavirus Response Act. That law became effective on April 1st. It only applies to employers with fewer than 500 employees. So if you have more than 500 employees, this still does not apply to you, and you may hear it referred to as FFCRA. So it became effective April 1st, 2020. And what this bill specifically is intended to do is to fill that gap for people who have been exposed to this disease or virus and need to be out of work or that have to care for somebody. And I'll go through the 6 specific elements here very quickly, but what I want to make very clear is this is not a catch-all paid sick leave. This is specifically related to COVID-19, and it is scheduled to sunset December 31st, 2020. So the intent of this, again, was to specifically address the issues related to COVID-19. It is not a catch-all paid sick leave. So if you are an employee of an employer with 500 or fewer employees, you may be eligible for up to 80 hours of paid sick leave under the new federal law. So the first condition is you are subject to a federal, state, or local quarantine or an isolation order related to COVID-19. That is a specific government order. That is not what our governor has issued. There is currently no federal, state, or local quarantine in the state of Nevada. Many people are confused, and rightly so, that they feel that the stay-at-home order or that the essential, non-essential created a quarantine. It did not. So the bad example, but I'm going to use it. So we've probably all seen it in the news. These cruise ships that are starting to come back and people are infected on some of these cruise ships. Some of the states and the federal government has issued formal federal or state or local quarantine orders telling those individuals you cannot get off that boat until a certain period. That is what would be deemed an official federal, state, or local quarantine order. And again, that could come at the federal level, the state level, or the local level. But the stay-at-home order is not considered to be a formal federal, state, or local quarantine order. So if you are hearing from employees that they are not going to come to work and that they are eligible for this paid sick leave because the state of Nevada is under a quarantine order, that is not correct. So number one, at this point, unless they have a specific one that was issued to them separately, number one is really not in play right now. Number two is probably more in play. The employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. So the unfortunate side of this particular one is that the employee, again, may have COVID-19, may not, but has been advised by a healthcare provider to not come to work. Now, the issue with this is that obviously an employer, and reasonably so, and it's in the law, that there has to be some type of documentation that, yes, a healthcare provider told me not to come to work. However, given the strain and the pressure and just the massive amount of work that our healthcare providers and our emergency responders are having to do right now, the ease of getting a note is not that simple. So in some situations, you may not be able to get a note from an employee. And what I would tell you, advice of the labor commissioner, is if somebody comes to you and says, I have been told by this doctor or this person that I am not to be here, you should allow them to utilize this paid sick leave for number two. The message from the federal government, the state government, is that this is an extremely serious situation. So do not take any chances. And again, err on the side of granting them that leave under the new federal paid sick leave law. So the third one is the employees experiencing symptoms of COVID-19 and seeking medical diagnosis. Again, as an employer, if an employee comes to you and says, I have a fever, I can't breathe, you need to grant them this leave under the federal paid sick leave law and allow them to go and get a medical diagnosis. So under the first three, if that employee is utilizing that leave, they are entitled to be paid for that leave. It's up to $511 per day. Now, again, not everybody makes that amount per day, and it would just be the normal regular wage rate that they get paid. But if they are out of work for any of those first three, they are entitled up to $511 per day. The other intent of the first three conditions is that that employee would be out of work for the full 80 hours, because if they are truly experiencing symptoms or truly potentially have COVID-19, they would go through the full 2-week cycle to either get treatment or to isolate. So the first three are intended that that employee would use the full 80 hours of paid sick leave. So the next three is where the compensation rate that is required goes down, because in the next two, the employee is caring for an individual who is subject to an order described in subparagraph 1, or has been advised, it's described in subparagraph 2, to self-quarantine. So in this situation, the employee is actually caring for somebody who might have one of those conditions. And what the federal government said is, we're going to allow them to take that leave, but we are going to reduce the amount of compensation that they are entitled to for that particular paid sick leave. So that is reduced to 2/3 of the rate, and it caps out at $200 per day. That is the same with number 5. The employee is caring for a son or daughter of such employee if the school is closed or the place of care is closed, or the child care provider is unavailable because of COVID-19. Again, the employee is entitled to 2/3 of their wage rate per day, capped out at $200 per day. And 4 and 5, the intent of the law was that the employee would be allowed to use that intermittently. So the employee could use, say, 5 hours one day of paid sick leave. They could use 4 hours another day. It is an option under 4 and 5. Number 6 is kind of the catch-all, and in discussions with the federal government, nobody really kind of knows what that means at this point, but the employee is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretary of the Treasury and the Secretary of Labor. Again, that has not been fully fleshed out. But again, the first 3, serious situation where an employee potentially has it, or they're under a federal, state, or local quarantine, or they're seeking medical treatment for it, they are basically going to be told to, and I would recommend this as an employer, to take that full 80 hours and to get healthy and then to deal with the situation afterwards. But that was the intent of the law. Again, where the child's out with school, or you're caring for somebody, the employee's caring for somebody, that can be used intermittently, and again, it's paid at a reduced rate. So the ability to get reimbursed by the federal government for providing this paid sick leave is still being fleshed out. So that is going to go through the Internal Revenue Service, and it's going to come in the form of some type of a tax credit. So for those employers that are already saying, well, how am I going to get reimbursed for this? There will be a process for that. It is just not up and running yet. So this particular provision, the paid sick leave, took effect yesterday. So again, the federal government is trying to get many of these things up and running as quick as possible, but that method for seeking reimbursement at this point is not there, and the forms are not there. So just know that. That may take another few weeks to actually get that, established with the Internal Revenue Service, and how that's going to look on tax forms and different things like that. But I will tell you that if you have employees that are falling under any of those 6 conditions as of today and as of yesterday, you need to grant them this paid sick leave in accordance with the new federal law. So they did carve out some exemptions for smaller employees. They also carved out some exemptions for healthcare providers and emergency responders. Now, obviously, with the need for healthcare professionals and emergency responders, they wanted to give some leeway to those types of employers where they wouldn't have to grant this type of leave, because they need people to be there at those places of employment. So that was the first carve out. The second carve out was a small business with fewer than 50 employees. And this is from the requirement of paragraph 5. So they carved out that you could get a potential exemption if basically allowing every single one of your employees to take the leave described in paragraph 5, and that's caring for a son or daughter whose school is closed, and that's really the scenario that we're talking about right now, that they would offer some type of a potential carve out for that. So I've been asked, well, how do I get that exemption? What do I do? So the guidance from the Federal Department of Labor is that you, as the business owner or as the authorized officer of the business, you are to write a certification statement basically describing the nature of your operations, the number of employees, and describe why providing that type of paid sick leave would jeopardize the viability of the business. Now, the Federal Department of Labor has issued guidance that this particular law, and the next one we'll talk about in the next slide, the paid sick leave and then the paid leave, there will not be enforcement on these particular laws for 30 days. They are going to allow employers a good faith effort to implement these provisions. And then after 30 days, how enforcement looks after that, we will have to see. These, again, are federal laws, but with the magnitude of the COVID virus hitting pretty much every state in the country now, there is a possibility that enforcement of these particular provisions will fall down to the state labor commissioner. So again, we will implement and enforce the federal law as is written, but for 30 days, you do kind of have a good faith grace period. Now, I would not recommend, again, not providing the leave, paid sick leave, especially for those first 3 conditions up there. I would provide that leave, and unfortunately, and I know this doesn't give comfort for a lot of employers out there, but some of these details are going to have to be sorted out later. I would emphasize, document to the best of your ability. And if you are going to claim that exemption for less than 50 employees, because it would jeopardize the viability of your business, I would have that statement. And again, whether somebody at some point, whether it's the state labor commissioner or the federal Department of Labor comes looking for, who followed the law, who didn't, again, have all of that backup documentation in place. And again, make sure that the people that are taking leave, that is documented, that you've documented when they've come back, you've documented what they've requested. My fear, unfortunately, and it had to be done, but with rolling some of these things out so quickly, again, that some of the details and some of the finer points may have been lost in just the initial rollout of some of these things. So again, document. And as you can see from the bottom kind of asterisk, the new paid sick leave law under federal law does also apply to part-time employees. So you are going to have to factor that into the equation too if you have part-time employees. Remember, though, that this law, the new federal paid sick leave law, is intended specifically to address COVID-19. So it has to be leave based on one of those 6 conditions. And as I mentioned earlier, it cannot just be that I'm scared to come to work. And again, not trying to diminish that, but as an employer, if you have a situation like that, obviously try and work through it, try and find out if they can telework, try and find out if maybe there's some potential paid leave available. But again, as an employer, and the labor commissioner will say this again, as an employer, if you have employees who are not reporting for work, not based on any valid legal reason or not based on any of these reasons identified here, you do potentially have the option of terminating employment. So again, just want to make that clear that this doesn't restrict your rights in other ways, but this is specifically intended to provide paid sick leave directly for conditions related to COVID-19. So let's go to the next slide, Carlos. So the second kind of part of paid leave, and this is rolled into the Family Medical Leave Act, was the thought process was, okay, let's deal with the immediate medical and potential health and safety part of this by having those 80 hours of paid sick leave available. And the hope was that by the time that full 80 hours passed, that the conditions, the medical conditions, potentially the school closures, would be gone at that point. I think all of us know now that that is not going to be the case. So the next part of the leave package that was rolled out was involving paid leave under the Family Medical Leave Act. So again, this took effect on April 1st, 2020. And again, it narrowed the scope of the leave to the employee is unable to work telework because the employee's child's school or place of care is closed, or the child's usual care provider is unavailable due to COVID-19 related public health emergency. So again, this is not a blanket, open, new type of leave. This is very specific to what it says under purpose, and it provides for up to 12 weeks of job-protected emergency paid leave. So the first days could be unpaid. Now, the reality is it's not unpaid because those first 10 days were intended to be the paid sick leave. So again, the vision was that an employee would utilize those first 80 hours under paid sick leave, so which comes out to 10 days. Then at that point, if the elements described in the purpose that the child was still out, that then the potential 12 weeks of paid leave would kick in. So again, they did cap the amount of wage replacement at $200 per day, but that leave could potentially go on for 12 weeks. So employers need to know that. Now, under Family Medical Leave Act, you still have to require the employee to file all the proper paperwork, to submit the certification. So all of that is still in place, but they did expand the length of leave just based on the COVID-19 for the specific reasons cited in the purpose. They also added some job protection language under the new paid leave, and this is under the Family Medical Leave Act. But again, an employer needs to know right up front that you potentially could have an employee off for 12 weeks because of issues related to COVID-19. So that comes as a little bit of a shock to some people, but that is the new reality. They did carve out some exemptions, again, for smaller employers, and it's the same standard that if you're going to claim that exemption, you need to document, and have that certification ready. So let's go ahead and go to the next one, Carlos. So I'll run through these very, very quickly. So these are just the constant updates that we're getting from the federal government about paid sick leave and paid leave. This was the first one, and you can go to the next two, Carlos, pretty quickly because they're all on our website under our COVID-19 tab. But these are just the daily updates that we're getting from the federal government and posting these on our website as soon as we get them, and typically within that same day or within a day. So let's go to the next one. And you can go to the next one, Carlos, because that's the same. So this one's an important one, and I'll run through the high points of this. This came out last Friday. This is from the state epidemiologist. This provides guidance about employees coming back to work or what employers should do if employees have symptoms. It also outlines if somebody has in fact had the symptoms or tested positive for COVID-19. It provides the guidance of how long they should be out and when they can be allowed back in the office. But please take a look at that one. That is a very important document, and that came out last Friday. So go ahead and go to the next one, Carlos. So the final slide here is a summary of the CARES Act. This was prepared by the Labor Commissioner. Now, just know up front that the State Labor Commissioner does not have any authority or jurisdiction over unemployment in the state of Nevada. So we have been flooded with a wave of calls and emails, and I can't get through, and I don't know what to do, and I certainly hear you, but I do not control any parts of that. But however, we did provide a summary of the CARES Act and what it is intended to do. And the term that is being used right now is called unemployment on steroids. That is what they're calling it. So I'll just kind of go through some of the highlights. So there's the potential for an extra $600 per week. They've also extended the benefit period. It could be up to 39 weeks on some type of unemployment. Typically it's 26 weeks. They also have waived, and the governor of the state of Nevada already did that about a week ago. They waived the 1 week waiting period. So basically you don't have to wait 1 week to get your unemployment benefits. It also expanded coverage, potentially expanded coverage to independent contractors, but I want to make this point very clear here as well, that if you look under expanded coverage, some of these requirements and some of the funds that are potentially available still have to be tied to COVID-19 and the events and the circumstances surrounding COVID-19. So again, I'm not going to go through this word by word, but please take a look at this. This is on our website. The actual bill, as you can see in the link above, is on our website. They did also factor in that there are some employers who they didn't lay people off. They just reduced their hours. They furloughed them or kept them on, but just reduced their hours. So there is some potential compensation that could be available based on reduced hours. And I'll just make a quick statement really quick here because I know we have some questions about furlough versus layoff. So furlough has a different potential legal ramification to an employer. Typically, if you're furloughing an employee, you may still be providing benefits. You may be providing them with office space. So you're still acting as an employer and you're still responsible for that employee. So even when it comes to the health insurance under Nevada law, you can't just cancel somebody's health insurance. There is a 15-day requirement to do that. So we're seeing a lot of employers saying, well, I'm just going to furlough my employees and, cut their benefits. And, to the extent that you have the ability to take advantage of a group like the Vegas Chamber or an employment attorney, beware that what you think you might not be doing at all. And at this point, and again, these are very tough business decisions, but at this point, some employers, it might be better to actually lay employees off and to allow them to get into the unemployment cycle. Obviously, there is a wave of people applying for unemployment benefits at this point, and the faster they get in that cycle and in that process, hopefully the quicker it will be for them to get their benefits. I know there was a news announcement today from the Department of Employment, Training and Rehabilitation that they know that there is a backlog, but the checks, when they do start coming out, will be retroactive. So again, I just throw that out there that this might be a point where as an employer, you really need to think, do I really want to furlough an employee or do I just need to lay them off and allow them to get unemployment, knowing that hopefully in 4 or 5 months, I might be able to bring them back. So I'll go ahead and stop right now and I'll take questions and address any other issues that anybody wants me to address.
Okay, Commissioner, thank you so much. Your slideshow was so thorough. I do want to go ahead and ask some of these questions because folks want some clarity on things. So forgive us if they're a little bit redundant, but I want to make sure people have a chance to get their questions answered. So the first one is, how can independent contractors apply for unemployment? Do they have to have a business license, a state business license?
So not trying to avoid the question, I think a lot of those details are still being worked out. My understanding is that, again, the forms and the actual guidance on that has not been published yet by the Department of Labor. So I would simply say that hopefully that'll come out very quickly. There's different definitions of independent contractor, even under tax law, and different definitions under unemployment law. So I would simply say, I don't know, and I don't mean to avoid the question. I don't know how that's going to look on that side, but as I get information, I will absolutely pass it along to the Chamber, and we will have that up on our website.
Okay, thank you very much. If I reduce employees' hours and pay by 50%, will those affected employees be eligible for unemployment?
So potentially they could be under the reduced hours portion of the expanded unemployment. Again, there's specific requirements on that as well, but potentially they could be eligible for some form of unemployment if their hours are reduced by, and the percentage that the Federal Department of Labor is talking about is greater than 10%, but less than 60%. And so I think the calculation there is that if you're going to reduce somebody's hours by more than 60%, you probably need to lay them off.
Okay, very good. If a healthcare provider seeks to claim an exemption of the FMLA or paid sick leave, what do you recommend for this documentation?
So I would just recommend, again, if you have a state license, which some healthcare providers do and don't, I would obviously have your state license and what you do, the nature of your operations, a brief description of that. But I think at this point, the way that the federal government has kind of interpreted that is if you are operating or have been operating as a healthcare provider, and that could expand to, a hospital, a clinic, a nursing home, those types of things. They've interpreted that definition very, very broadly. Now, the one caution I would put on that is that, again, the intent of this is supposed to be related to COVID-19, so that those types of operations could provide, services and assistance directly related to COVID-19. So I wouldn't, if I was operating something that truly wasn't healthcare related, but calling it healthcare related, I would not push that. And I'm not trying to single any groups out, and I'm not trying to, again, diminish the health benefits of certain things, but we had that question come up with massage. So there are, things with massage where it is related to a physical therapist or to a health provider, and then there's some things that are not. And I just bring that up as an example that I would not push that definition. It should truly be something that is health related.
Okay, very good. Next question is, do businesses have to provide emergency FMLA after the stay-at-home order has been lifted?
So that's going to depend, again, on a case-by-case basis. Obviously, if the school's still closed, that is what that particular section is specifically trying to address is, the quarantine may have been lifted, but the school might still be closed, and that employee may still be required to be home with the child. And I will just make this comment, too, that we've had a lot of questions of, well, the school's not really closed because they're doing distance learning. No, the schools are closed. That is done. The schools are closed. So again, that's going to depend on, if those schools are still closed or if that place of care for that child is still closed, then potentially that employee may still be eligible for some form of paid leave under the Emergency Paid Leave Act.
Okay, very good. I think we have some folks who would like to ask their questions in person. Lynn Polito Perez, if you'll unmute your phone, we will unmute your line. Lynn, are you there? Okay, Lynn, I know you're there. Go ahead and ask your question if you can hear me. Okay, we can get back to Lynn. We also have Rhonda Hawley. We'll try to take a few of these questions over the line. I love it when our listeners get to ask their own questions. So Rhonda Hawley, if you're there, you can unmute your phone and ask your question. Okay, we'll try to get back to these folks. Let me ask you the next one. We closed our small family restaurant on March 18th due to family members being at high risk to COVID-19. Is still liable for the Paid Sick Leave Act?
So the interpretation from the Federal Department of Labor and the plain language in the FFCRA is that if you closed your business prior to, or you laid people off prior to April 1st, 2020, your employees are not eligible for the paid sick leave or for the paid leave. So the decision making there is that basically the business is closed. Now those individuals and those employees need to go down the unemployment road because that business is no longer operating.
Okay, very good. This one is going back to your furlough topic from just a few minutes ago. It says, so if someone is furloughed, they will receive unemployment compensation, correct? Also, if someone is furloughed, is the employer required to provide insurance for that employee?
So again, that's going to be a case-by-case basis. If you are going to furlough an employee that you are currently providing medical benefits to, there is a 15-day notice requirement to terminate those benefits. So that has to be factored into the equation. And again, the unemployment part of it is going to depend on how much you reduce their hours. So the range that the federal government has come up with is if you reduce their hours by 10%, but not greater than 60%, then they may be eligible for some type of unemployment compensation. But again, I don't want to say as the labor commissioner that they are automatically going to get it, because I don't have jurisdiction or authority over that. That is the intent of this, is that in a situation like that there is going to be unemployment funds to make up for those lost hours. But again, I don't want to say that's a guarantee. And if you are going to cancel some of these benefits, like I said, you have to keep in mind of that 15-day requirement to do that.
Okay. This is very complicated. Thank you so much for taking the time to answer these questions. We have several more if you have a few more minutes.
Oh, yeah, of course.
Okay. How can we keep our workers safe when employees who claim to be sick and took off now want to come back to work with the assertion that they are fine?
So I think as an employer, you need to tell them to leave the workspace. And to the extent that they have any available leave, I would give them the option of utilizing that leave to stay away from the work location and workspace. If it is a situation where an employer, and unfortunately, even in my position and all of our positions now, those of us that are still going into offices, is that you don't want to become a doctor, and we're certainly not doctors, but if somebody is exhibiting symptoms where they could potentially, be potentially under that number 3, where the employee is experiencing symptoms of COVID-19 and seeking medical diagnosis, you might want to recommend to them that they need to go do that, and that this potential 80 hours of paid sick leave is available. But, I did a presentation with the Division of Industrial Relations this morning, and that's OSHA. And we did a joint presentation, and the message is this, unfortunately, is one of those times where you're better to err on the side of health and safety of your other employees and have that employee off the job site, and just tell them to leave. And again, I don't want to encourage an employer to terminate employment to get to that level, but your liability potentially as an employer, you need to have that employee off of the job site and not allow them to come back.
Okay, very good. Next question is about opening an essential business. How do we find out if we can open as an essential business, and what the opening parameters are?
So, I would still go through the normal process of going through the Secretary of State's office. I would review the regulations, again, that are on our website about what's essential, what's not essential. Obviously, go through your local jurisdiction for the local licensing and business licensing, and they would probably be able to give you some good advice as well of what they're, interpreting as essential, non-essential. But I would review those materials first. But my understanding is, the Secretary of State is still issuing business licenses. As far as I know, all the cities, counties are still issuing whatever licenses they need to. So again, and on that specific question, Mary Beth and Paul, if that individual wants to submit a description of what they're doing to me, I'd be happy to respond back to them, offline.
Okay, very good. You sort of touched on this, but I'd like to get the question in anyway, because it seems like there might be a nuance to this. Can an employee that is afraid to come to work at an essential business collect unemployment when we have work and are having to pay others overtime to fill these shifts?
So my opinion on that, and again, my opinion would be no. Now, again, there would have to be some type of separation of employment. So if they're still technically on the books of the employer, unless they're arguing that they have the reduced hours and are going for that type of unemployment, they wouldn't be eligible until there was some type of a separation of employment. So, in a situation like that, and again, I'm not trying to encourage employers to in a situation like that, if you have an employee that's doing that and you haven't found a way to fix it, you're probably going to have to terminate employment. And at that point, then they might get in the unemployment cycle and might be eligible for unemployment, but just staying away from work and still technically being an employee without the furlough situation, that would not entitle you to unemployment benefits.
Okay, very good. We are a non-essential business that was closed, and I think you kind of touched on this too. And it says, I paid wages through March 31st, even though we were closed, but going forward, we are not able to continue paying payroll and advise employees to file for unemployment. Do I have to legally furlough or lay off, or can they just apply for unemployment?
So what I would recommend is that if you issued the final paychecks, and I believe you said, Mary Beth, on the 30th, and now you're not going to be able to do it in the next 2 weeks, you need to, and if it's closed, if your business is in fact closed and because it's not essential and you don't know when it's going to be open, again, you may have the ability to keep one or two, and I'm just saying this as an example, one or two people on some type of furlough situation, again, knowing that they might be eligible for unemployment. The other individuals, if you're not going to be able to make payroll, I would recommend laying them off and issuing them final paychecks to the best of your ability and allowing them, again, to go and pursue the unemployment avenue. I believe, at some point the chamber will probably have more information on it, but there is a program out there now called the Payroll Protection Program, where you can potentially apply for a small business loan to cover payroll. That is, again, being rolled out. Some of the details are still being sorted out, and that has an application process and everything like that. But my recommendation is, I wouldn't want to get caught in a situation where you knew you couldn't make payroll and chose to keep those people on, and then they don't get paid, and then they come to the labor commissioner and say, I didn't get paid. So I would address the situation as soon as possible. And if you need to cut whatever final checks you need to cut and lay them off and terminate employment, I would recommend doing that.
Okay, very good. We're getting a lot of questions about EFMLA and summer break. If summer break happens, will EFMLA still apply if the stay-at-home order is lifted?
So again, this is specific to school closings, and we don't know, and I'm just going to say this. We all anticipate that there's going to be a summer break. However, it is entirely possible, and I know I went through this when I was in school, when we had a flood up in Reno, that there could be makeup days or there could be a makeup month. Again, I'm not saying that's going to happen. If there is truly a summer break where, again, there is no school and the child isn't required to be cared for, and again, I'm going to use that term loosely, then potentially no, that employee would not be entitled to that emergency FMLA leave. But again, I don't want to say anything definitive, because for school districts for kids who've been out of school, even with digital learning for potentially 2 or 3 months, it is a possibility that summer break may not be the full summer break that everybody expects it is.
Okay, very good. We've got just a couple more questions, but in the meantime, folks are asking who would be the best point of contact through your office for additional questions?
So they can absolutely send them to our mailbox. It's mail1, so mail, the number 1, at labor.nv.gov. And just so all of you know on the call, and Mary Beth and Paul, so I have personally been monitoring that mailbox, responding to all the questions since early March, so it will be me. I would give out my personal email, but sometimes that doesn't go well. So I will, and you'll get a response within a day. And Mary Beth and Paul know that I will respond. So mail one at labor.nv.gov. But I have been answering those questions personally, and part of it is to control the message and to get accurate information out there. But you are more than welcome to send those through that channel.
Okay, excellent. Next question. If a person quits with no notice, are we required, or is a business required to give 15 days notice of cancellation of health insurance?
So the way the law reads is you technically do, and the way insurance works, and again, this goes more to an insurance division question, is depending upon when those premiums were paid and how they were paid, the benefits may still go through the month, or they may still go through the half of the month. So that's going to, again, be kind of an individual situation. I have recommended that if an employee quits and you want them off your insurance, that you should give them the 15 days notice and, make that an official declaration. But there is a possibility, and we have seen this, just the way premiums are paid, that they could technically be on your policy for a full month.
Okay, very good. I think we just have one more question. And this one is, for the construction industry, if a worker on a job site tests positive and the job site advises employees to self-quarantine for 14 days, are those employees eligible for the paid leave? My company has more than 50 employees.
So again, it's going to depend on if those other employees that were exposed to that person show symptoms. And I would again go back to number 3 for the emergency paid sick leave. If they start to demonstrate, any level of symptoms where they need a medical diagnosis, I would recommend granting them the leave to address that situation. Now, certainly understand that on a construction job site, if you have 20 employees there one day and then not the next, that's not going to be a good situation on any level. But I would also state that, you also need to be practical. If only one person was exposed to that worker, then maybe only one person needs to isolate or be given paid sick leave. Obviously, clean and take whatever steps you need to do to make sure that work site no longer poses a risk to the employees. But again, the message all the way from, like I said, the federal government all the way down is to always err on the side of the health and safety of the other workers. And again, try and isolate who that employee was, who they came in contact with. The other thing that's happening, and again, it's a natural human reaction, but, the word goes around that somebody has symptoms or that they tested positive, and the reality may be that somebody in that same, vicinity may have never even come near that person. So what we're recommending, and again, not necessarily under my jurisdiction, but a lot of construction companies now are basically creating new titles for individuals that they are kind of, and I'll just use the term, kind of the safety inspector for the day, that they are having meetings in the morning with the workers saying, this is what you need to do. They're having meetings at the end of the day, this is what I saw that went right, this is what I saw that went wrong, but monitoring the situation. And again, if there is an employee that has potential COVID situations, isolating that employee, getting them out of the job site as soon as possible, and then, working backwards of who actually was around that person, who does need to be quarantined, who doesn't, instead of just a mass kind of panic reaction at the start.
Okay, very good. Commissioner Chambers, we really thank you for your time today. I think you're going to get some emails here pretty soon based on all the questions we had today. Well, excellent. We sure appreciate your time. Thank you so much. You've been such a great friend to the Chamber and our members, and we can't tell you how much we appreciate your service.
No, again, and thank you all, and hopefully I will see you in Las Vegas in better times in a few months. So, again, thank you, Mary Beth. Thank you, Paul.
Thank you again, and thank you all for joining us on today's call. As resources and new information become available, you can always count on the Vegas Chamber to keep you informed. Our teams have been working around the clock to do that. We appreciate the business community for doing their part of working remotely, being innovative, and supporting each other and the entire community, because together we're all going to get through this. So thanks again, everybody. Thank you again, Commissioner Chambers, and we will talk to you soon. And that does it for today's call. Thanks so much. Bye-bye.
Thank you. Bye-bye.